Dr. Paul, did you know that scoliosis, which is where the spine is curved, and things like back pain, and even pectus, where the sternum is caved in, these are musculoskeletal issues that as a pediatrician, I was taught there's nothing you can do about it. You just watch it until it gets bad enough that you need surgery. In the case of scoliosis, they put a rod. So I'll look at this spine here. And with scoliosis, that spine would be curved. Usually it's an S curve. So it's curved one way here and then back the other way. So it looks like that. And when it gets bad enough, they put a rod through and just straighten it. Of course, you now can only move like this because you don't have that lateral movement. Well, I have worked with a pediatric body worker who brought it to my attention that two things can actually alter the course of scoliosis and even pectus, and I've actually seen it in several patients of my own. I'm retired. This is informational. I am not diagnosing, I'm not treating, I'm just giving you some very important information that you can then take to your trusted healthcare provider and possibly implement very simply at home to really change the trajectory of what's going to happen for your child who may have scoliosis. Now, the interesting thing about scoliosis is we were taught as pediatricians, have your kids touch their toes, right? And so you look at my spine, I'm touching my toes, and you see if it looks straight. What works so much better is have the child put their hands out like this and look for tension along the spine. Have them put their hands up, out to the side, and you will see subtle differences in tension, and sometimes you'll actually see a curvature. Those who have any amount of tension or curvature, there's probably a number one underlying reason for it, and it's sleep posture. So I wanted to go to the literature and say, is there anything written about this? So it's very interesting. I did a literature search. PubMed looked for scoliosis etiologies, in other words, what's causing it, and also can you do anything naturally, simply, whether it be massage or chiropractic or something. Turns out there's an article, 2021, effects of myofascial release or self-myofascial release. So you can learn to do this at home and control position exercises on low back pain and in idiopathic scoliosis. So, and this was a systematic review. Idiopathic means we don't know what causes it. And in fact, I found two other review articles. They both said, we don't know what causes scoliosis. Well, there's a clue. The clue comes in the fact that, yes, myofascial, which just means muscle, and fascia, which is massage, right, body work, can change the trajectory of scoliosis. But the other thing that makes a massive difference, let's say you don't have access to a body worker that can really work on those paraspinal muscles, is sleep posture. So I'm going to show you what I mean by that. And in the process, we're going to review some pillows, because getting the right pillows is key to having good sleep posture. So we'll start with, I want you to see, I'm just going to move these out of the way, and I'm actually going to use an elephant as my second pillow. You need 3 pillows. This is whether you're an adult or a child. You need a pillow that's going to go under your neck. And remember, our goal is to keep nose and sternum in alignment, and we want that spinal cord. Here we are sleeping. We don't want it twisted like this or twisted like that, or twisted like this because of your various body positions. We want just a straight forward alignment. So here's the hips. You can imagine there's a leg off here and a leg off here. If this leg is not supported with a pillow between your legs, you're going to have a lot of pressure. It's going to start twisting that spine. So you need a leg pillow that's big enough to go from your knees through your feet. So you see how now my hips, this leg is totally in alignment. Without this pillow, my hips collapse. I feel that pressure on my low back. I put that pillow in there, totally comfortable. You want to stay on your side, not on your tummy, and you want this arm here relaxed. So that, remember, we're keeping, the goal is my chin in line with my chest. So I need a pillow under my head that's not too big so that I'm like that, and not no pillow. Now you can see my neck is falling. So the right size pillow, this one's pretty comfortable. And then this arm, I don't want it collapsing. I need a third pillow or a stuffed animal. So you can see my spine is pretty neutral. If you have a kid, you might be able to get away with just a regular size pillow between the legs, a stuffed animal that's just general right size for the kid here. And then I think these head pillows are really the key to comfort. You want a head pillow that just feels right. So I ordered a bunch of pillows just to see how they felt. And so we're gonna just try a bunch of them. This one I like because of this little indent here. This is a Cosmic, and Space Dream Cosmic. I don't know if that's the brand. Unfortunately, it was taken out of the wrapper, but it kind of cradles my neck. So it's just like, ah, that's nice. And the thing is, if you haven't been a side sleeper, which I wasn't, I used to sleep on my stomach. Here's the problem with stomach. So I'm on my stomach. I have to turn my head. So I am twisting that spine. The cervical spine has to twist in order to be comfortable. And here's the interesting thing. This is comfortable for me. I couldn't sleep like this. So I think my whole childhood and most of my adult life, I slept like this. And now I sleep side lying with my nose to chin, and I'm sleeping so much better. I can't do this. It's very uncomfortable. So I already have some degree of, yeah, that just puts the stress on me. This is like, that's comfortable. I could go back to this, but it's not helping the situation. Okay, let's just quickly review a few other pillows, just for fun. We'll go over some neck pillows. So here's one. It's called Billabong. I like the idea of sleeping on clouds. I used to, when I was in high school, I was a high jumper, and I would see clouds in the sky, and I said, I'm gonna jump up to the clouds. And then I was at the national finals, and there were no clouds. I missed the qualifying jump. So I psyched myself up. That was a total irrelevant aside. This one's nice and soft. I don't know if it gives me quite enough support, but not bad. We've got a cute pillow. What's this one called? I can't tell. Is there a name on it?
Chuck Chick.
Huh. It's kind of got a little thingamajiggy. It's got a slight indent here. For me,
You look too low.
way too low. It's not enough support, and probably wouldn't be enough support except for the tiniest kid. Cute though. This one's also going to be way too small for me. There's not enough support. But for a little, toddler, 3-year-old maybe. Here's another one. This is called the Urban Infant.
Good vibes from this one.
Yeah, it's got enough support. Yeah, that one will work. We've got this one. Oh, this feels, unfortunately, it has no name.
You look too low.
It's a little too low for me, but it's got a nice sort of like foam. What are those beds that have that?
Tempur-Pedic.
Tempur-Pedic. It almost feels like a Tempur-Pedic, but it's a little too low for me. So you start to get the sense this one's going to be too low. Yeah. So there you have it, folks. The importance of side lying from your knees all the way through your feet, some other pillow to keep this shoulder from collapsing, and then the right size pillow so you're just and you can learn. I've learned to, this is a little massage table, but I've learned to just keep that pillow between my legs and flip right over, because you don't stay on one side the whole night generally. And I'm back to being comfortable. This will help you not only prevent scoliosis, but it will actually help you start to have your scoliosis resolve as you take those forces that keep pulling the spine in one direction all the time and put you back into neutral. So easy trick you can do at home, and it's going to do a lot to prevent problems down the road. Thanks for watching. I'm Dr. Paul.